At the end of the study period, everyone weighed in. In just 12 weeks, the average participant had lost 16 pounds. Their fasting blood sugar had dropped 28%. Two-thirds of the participants on diabetes medications were able to reduce or discontinue them in that short period of time. All this occurred without any limits on calories, portions, or carbohydrates, and without exercise. These effects were significantly greater than those seen in a control group carefully following the diet guidelines of the American Diabetes Association, ADA. That was impressive. But why did it happen? How does a diet that gives a green light to pasta, rice, and all the other foods that people with diabetes thought they had to live without, and one that completely disregards calories and avoids exercise, cause blood sugar to plummet and weight to easily drop away? To answer that question, we designed another study. This one included a group of women who were moderately or severely overweight but did not have diabetes. Once again, we zeroed in on animal fat and vegetable oils. Our participants set animal products aside and kept oils to a bare minimum. And they were free to implement the diet guidelines in their own way, whether they ate at home or ate out, so it was a good test of how the diet would work in real life. For one person, eating out might have meant mushroom stroganoff with steamed vegetables. For another, it might have been vegetable sushi with miso soup and salad. As long as they avoided animal products and kept oils to a minimum, they were free to shape their meals to their liking. For comparison, we included a control group whose members followed what you might think of as a typical cholesterol-lowering diet. It cut back on red meat while emphasizing poultry and fish, along with plenty of vegetables, fruits, and whole grains. The results were quick and impressive. The vegetarian group participants lost about a pound per week. After 14 weeks, they had lost an average of 13 pounds, compared to 8 pounds for the control group. By now, it was no surprise that this diet causes weight loss, but we went a step further. We sent our participants to the laboratory for a glucose tolerance test, which allowed us to measure how their bodies responded to sugar and how well their body's insulin was working. Each participant swallowed a dose of sugary syrup, and we took blood samples every half hour to measure rises in blood sugar and insulin. From this laboratory data, we were able to calculate each woman's insulin sensitivity and track how it changed as the study progressed. The results were remarkable. The tests showed that our participants were physically changing. Based on their laboratory measurements, it was clear that their body's cells were becoming more and more sensitive to insulin. By the 14-week point, their insulin sensitivity had improved by 24%. In other words, something about the diet reactivated their natural insulin's ability to open cell doors to glucose. What that means, of course, is that the diet was addressing the fundamental problem we see in type 2 diabetes. It was helping glucose get to where it belonged. The study turned up another particularly remarkable finding. In a laboratory at George Washington University, we measured the participants' metabolism, how fast their bodies burned calories. This was done by measuring how much oxygen they consumed minute by minute and how much carbon dioxide they produced after being given a test meal, 2 cans of a standard liquid formula. After 14 weeks on the experimental diet, it was clear that the participants had a significant increase in their after-meal calorie burn. Their after-meal calorie burning speed increased by 16%. What was happening was that the diet had made their cells more sensitive to insulin's action, so they were able to take in nutrients more quickly. Glucose got out of the blood and into the cells, where more of it could be burned up, so to speak. These calories are released as body heat rather than being stored as body fat. Scientists call this the thermic effect of food, and it provides a small extra edge for weight loss. Based on these and other studies, the National Institutes of Health, the research branch of the U.S. government, decided to fund a new study. Working with me on the project were researchers from George Washington University School of Medicine and the University of Toronto, and dietitians and physicians working with the Physicians Committee for Responsible Medicine, a nonprofit organization I founded in 1985. The study included 99 people with type 2 diabetes. For 22 weeks, 49 of them followed a diet that was similar to those we had tested earlier. The diet was vegan, meaning that it included no animal products at all and was low in fat. Also, while we placed no limits on the amount of carbohydrates our participants could have, we encouraged everyone to be selective about the kinds of carbohydrates they ate. Instead of white bread, we encouraged them to choose rye or pumpernickel. Instead of baking potatoes, we favored sweet potatoes and yams. The remaining 50 participants followed a diet based on the ADA guidelines. Once again, we restricted exercise. Over the ensuing weeks, many participants found their blood sugar falling to the extent that they had to cut back on their diabetes medications. That was a happy outcome, but it was not our goal. In fact, we were trying to keep medications unchanged as much as we could so we could isolate the effect of the diet on their blood sugar. The combination of the diet and the blood sugar-lowering drugs was so powerful, however, that many participants had to reduce their doses or discontinue medications altogether to keep their blood sugar from dropping too low. To really gauge what the diet could do, we looked at those participants whose medications had stayed constant and how the diet affected A1C, the principal gauge of blood glucose control. The ADA diet had reduced the A1C by 0.4 percentage point, a good change. But the vegan diet was 3 times more effective. It had reduced A1C by 1.2 percentage points. The average person's value fell from 8.0 to 6.8% during the 22-week study. That is a stronger effect than is seen with a typical diabetes medication. The common diabetes drug, metformin, glucophage, for example, reduced A1C by about 0.6 percentage point in a large research trial. The vegan diet also proved highly effective in reducing body weight and cholesterol. To put all this in perspective, the landmark UK prospective diabetes study showed that a 1-point drop in A1C for people with type 2 diabetes lowers the risk of eye or kidney complications by about 37%. This is the effect of just the A1C drop without considering the ability of the diet to also reduce cholesterol and blood pressure. In the next chapter, I will show you how you can test this diet to see what it can do for you. But let's look a little bit closer at the science behind this approach. Toward the perfect diet. Setting aside animal products and keeping oily foods to a minimum may sound challenging, but our participants commonly reported just the opposite. One man, Walter, said, "I'm amazed at how easy it was to adapt to this diet, and I feel great. Within 2 months, I lost 20 pounds. And the more amazing thing to me is that my glucose averages have fallen by 30 to 40 points. For Mark, the change was an adventure. I tried new restaurants, new recipes, and different foods I never would have eaten before. My main goal was to lose weight, and I've lost a good 30 pounds so far. When I started, my fasting blood sugar was 260 to 360, and it dropped like a rock. Now I'm between 130 and 135, and I don't get tired in the afternoon like I used to." Nancy agreed. She felt totally adjusted to the diet within about 30 days. And within 5 months of making the change, she said, my blood sugar fell so much that I was able to stop one of my medications. I have much more energy and really feel tremendous. I will walk you through the diet step by step. If it sounds like a very healthful diet, it certainly is, and not just for controlling blood sugar. In 1990, Dean Ornish, MD, a young Harvard-trained physician, discovered a remarkable feature of low-fat vegetarian diet. He tested the diet in individuals with heart disease and added other healthy lifestyle changes, regular exercise, stress modification, and smoking cessation. Because the diet contained no animal products, it had no cholesterol at all and very little fat. After a year's time, each patient had a special X-ray of the heart called an angiogram, and Dr. Ornish's team compared the results with angiograms done on the same patients at the beginning of the study. The results made medical history. The patient's coronary arteries, which had been blocked by years of poor diet, were actually starting to open again. The difference was clearly visible in 82% of the patients after 1 year. This occurred without surgery or drugs, even without cholesterol-lowering medication. Other researchers have shown that this same sort of diet change reduces blood pressure. Apparently, eliminating animal fats reduces the viscosity, thickness, of the blood. That is, the blood becomes less like grease and more like water, so it easily flows through the arteries, causing blood pressure to fall. Blood pressure is also reduced by the potassium in vegetables and fruits, and other characteristics of plant foods augment this benefit. Vegetarians are slimmer too. The average person who embraces a vegetarian diet loses about 10% of his or her body weight. These changes would be welcomed by most of us. But if you have diabetes, they can be life-saving. This is because, as you heard in Chapter 1, persistently high blood sugar can attack the blood vessels of your heart, eyes, kidneys, and legs. What kills most people who have diabetes, that is, those who have not made the diet changes you are hearing about, is damage to their hearts. A diet that reverses that process, turning the clock backward on heart disease, reducing blood pressure, and trimming weight, is powerful medicine for everyone with diabetes, whether type 1 or type 2. Imagine if your eyes were damaged by the disease. An ophthalmologic surgeon, laser in hand, would carefully try to repair your tender retinas. But what if foods could help avert this damage in the first place? A diet change that brings your blood sugar under control, brings your blood pressure down, and helps rejuvenate your arteries gives a measure of respite to the tiny blood vessels in your eyes. It does the same for the tiny vessels that make up the filtering unit in your kidneys, making it less likely that you will ever need dialysis, and of course, it works powerfully inside the heart. Now, do not misunderstand me. I am not suggesting that you should forego needed medical treatments and rely on diet alone, but